My name's Joanne Moore, and I'm a physical therapist. You're about to undergo thoracic surgery. During this procedure, the doctor will need to keep your arm overhead for a period of time. If you have any tightness in your shoulder or pre-existing shoulder condition, you may find that your shoulder is going to be sore after the surgery. I've developed some guidelines and some exercises to help you prepare for your surgery. These exercises are going to help you be more comfortable during your post-op recovery period. We'll look at your shoulder's flexibility and at its strength. And if we identify any areas of weakness or stiffness, we'll develop some prevention strategies that will address those problems very specifically. While standing, bring your arms out to the side and reach up as if you're doing a jumping jack. Can your inner arms reach your ears? Keeping the elbows against your body, can you reach your hands out to the side 90 degrees? When standing, can you slide your thumb up your spine to the level of your waist or above? If any of these movements were challenging for you, talk it over with your doctor. If you have pain, stiffness, and weakness, you might benefit from seeing a physical therapist prior to your surgery date. If you're just a little stiff, try these exercises to help you get more flexible. Having full flexibility will make you much more comfortable during your post-op recovery period. Stretches should be performed when your muscle is warm. You can warm the muscle either by applying a heating pad or taking a shower, or simply by being active in getting the muscle warmed up through activity. Perform each stretch until you feel a gentle pull on the muscle, and then hold that position for 30 seconds. Repeat the exercise between 5 and 10 times, once a day. You shouldn't feel any soreness really during the exercise or after. But if you find that you develop soreness, discontinue the exercise for the rest of the day and apply ice for 10 minutes. You can resume exercise again the next day, just be a little bit more gentle. For the pendulum exercise, stand and bend forward at the waist, hang the arm down, and gently draw a circle with your hand. Continue for 15 seconds in one direction, and then change and continue in the other direction for 15 seconds. Stand, draw your shoulders up towards your ears, then back and down. And repeat, drawing your shoulders up towards your ears, then back and down. Repeat this 5 to 10 times. Stand holding a dowel in both hands. Lift the arm out to the side, allowing the strong arm to push and help the weaker arm to lift higher. Stand holding a dowel with both hands. Bend your elbows 90 degrees. Keep your elbows tucked in tight at your waist and move your hand out to the side. If your left shoulder is the tight shoulder, grasp the corner of a towel with your right hand. Then raise the towel so it drops behind your back. Take your left hand with the palm facing back behind you and let the right hand pull the left hand up your spine, trying to reach for that spot between your shoulder blades. To stretch the levator scapula, grasp your hands behind your waist. Drop your shoulders down, turn your head to the right, and look down. For the pectoralis muscle, stand with both hands resting on a door frame. Your hands are at or above your shoulder height. Step forward with one foot and move your weight forward onto that foot. Feel the stretch across the front of your chest and shoulders. Lie on your back with your knees bent. Grasp a dowel in both hands, reach the dowel up towards the ceiling, and then over your head as far as your muscles can reach. So remember, stretching exercises should be done when your muscle is warm, should be performed slowly and held for 30 seconds. Repeat 5 to 10 times for each exercise. You only need to do them once a day, and it shouldn't have any soreness when you're finished. For strengthening exercises, a weight should be light enough so that you can lift it 30 times without any discomfort. Stay with the same weight for 1 week. If at the end of 1 week that becomes too easy, you can increase the weight by 1 pound at a time. Do each exercise 30 times, but rest after each set of 10 for 30 seconds. So repeat it 10 times, rest for 30 seconds, then do 10 more, rest for 30 seconds, and then do the last set of 10. For the serratus anterior muscle, lie on your back with your arm reached straight up toward the ceiling. That's the starting position. And now reach a little higher so that you're reaching for the ceiling and come back down. You should probably be able to raise the hand up about 4 inches from the starting position. External rotation. You start lying on your side. Place a small towel in the armpit. Start with your hand across your abdomen. Keep the elbow tucked in tightly at your waist and lift your hand up toward the ceiling. Use light weights for this exercise. Abduction. Stand with a weight in your hand. Bring your arm out to the side, keeping your elbow straight until the arm approaches your ear. Hold a weight in your hand, bend forward at the waist, holding on with your other hand for balance. Bring your elbow up toward the ceiling as if you were starting your lawnmower. Keep your elbow up to shoulder height. So remember, strengthening exercises should be done with a weight that's light enough for you to accomplish the exercise 30 times without discomfort.